Dr. DEBTOSHSAHA, Diabetology Asansol. Today's my topic is hypoglycemic awareness. Importance of hypoglycemic awareness. At the initiation of treatment of every diabetic patient, I always categorically aware diabetic patient about hypoglycemic awareness, and also in case of illiterate, semi-literate patient, I select caregiver. That caregiver may be his wife or another relative who has some education level, and thereafter I take usual follow-up. Hypoglycemia awareness is very important for this reason. If patients feel something unusual, haziness of vision or unusual sweating, anything, in that case you have to check through your glucometer your blood sugar level. If below 70 milligram DL, you should take one chocolate. If below 60 milligram per DL, you have to take one sugar cube immediately. And if below 40, then you have to rushly patient to be shifted on emergency department for further proceedings like 25% glucose, IV infusion, anything. But important is priority and emergency shifting of the patient. Then comes to the role of the caregiver. Why role of the caregiver is so important? In my last part of video, I have enclosed one interview in Bengali of my current patient who has today suffered from hypoglycemia, and caregiver has rescued on instruction over phone from me and prior training which has been already given to him. And so caregiver has taken already necessary steps. Next comes to the diabetic patient education. Why so important? Diabetic patient education is important for this reason. He has to follow advice of not only the medicine intake in proper time, before lunch, after lunch, before breakfast, nothing. Always to obey medical nutrition therapy that is individualized I cater. That to be follow, and also the lifestyle modification and diabetic patient education and diabetic patient counseling also I done in my level best. Next also come of the role of treating diabetic doctor. As in my personal level, I always think quality time to be spent for individual patient, not to hurry. Patient comes within 10 minutes, 15 minutes, go, not to that. And regular follow-up on emergency, every time you pick up patient phone call and listen that in any case, that may be in night 1 p.m. or in morning 4 p.m., 6 p.m., 7 p.m. But if you have to remember patient and also case history. So give quality time to patient and remember your patient case history, and always save mobile number so that in emergency you can help patient to shape your patient or on need, and you give it proper guidance. In my next part, you see the today's patient experience have faced, and patient have successfully responded, and patient is now glucometer checking 80 to 90 milligram per DL, and hypoglycemia soon recovered and from normal glycemia, and this patient is very good. Listen second part.
স্যার পেশেন্ট ইনি যে প্রভাত সিং, এনার সমস্যা হচ্ছে কি ঘুমিয়ে সে উঠতে পারছিল না। হ্যাঁ, তারপরে যখন দিয়ে দেখলাম তো ওনার কিছু বলছে না, বাবা সেজে যায় না, উনি ধরনা বিহেভ করছে। আমরা তো ভয় খেয়ে গেলাম কি পাছে স্ট্রোক হচ্ছে নাকি। হ্যাঁ, তারপর সুগার নাপলাম, 32 করছিল। তারপর ডাক্তার দেবতোষ সাহাকে আমি ফোন করলাম, উনি তুরন্ত ওনার যে প্রসিজার ফলো করতে বললেন উনি যে শেষে করলাম। তারপর রোগীর আবার ঘরে সুগার নাপিয়েছি, 82 দাঁড়িয়েছে, সেটা আধা ঘন্টার ভিতরে। আর পেশেন্ট যে আছে বেশ তুরন্ত।
আচ্ছা, আপনি কেমন আছেন এখন? আপনি বলুন কেমন আছেন?
আপনি
হ্যাঁ,
ঠিক আছে।